All right. So we'll look at the importance of keeping things, everything neat in a radiology lab. So I think we've always spoken a lot about neatness, but it's always associated with other labs, other labs, other labs. So in the radiography lab, you know that, yeah, definitely, um, you have to actually, keep the place neat. But for students now, the most important thing is you're trying to know the reasons why. Okay. You're trying to know the reasons why. Okay. So, aseptic technique in radiology lab is all about you're trying to keep everything neat because you want to actually prevent uh, any issue by, okay, all those infections. So, core principles of aseptic techniques in radiography is first of all hand washing. So you want to wash your hands very well before you touch a patient, and after you touch after you have touched the patient. So you can use all those alcohol-based hand rubs when appropriate. You wear gloves where necessary. Okay, a lot of things. Personal protective equipment, that's the PPEs. So you make sure that your gloves, you know, your gowns, your masks, eye protection, everything is there. So you change gloves after touching a particular patient. You don't use the same gloves and go and touch the next patient. So equipment and environment is you have to just disinfect all those tables, dictators, and positioning aids. Just to ensure that that's after you use them for a particular patient. You know, you don't want to still move the same thing to the next patient. Okay, so I think for that factor, that's what we got. All right. Then patient preparation. So you just have to clean and disinfect the skin. Before any of those procedures I have to do it, you are invading. Invading the skin. You don't want to drive infections from outside to inside. You know. So you have to ensure that wounds and dressings are intact and protected. So safe handling of contrast media and instruments is you have to use all those sterile syringes and needles for contrast injections. Avoid reusing disposals. The waste management. This is where you now segregate infectious waste in designated bins. You dispose the contaminated materials and all of that. Then staff training and compliance is the staffs must always be trained, like continuously. So new things come up and they are also aware and all of that, and they should always put infection control as their top priority. Because as a staff you don't want to get infections as a result of your work, and as a patient too, you don't want your patient having infections as a result of coming to the hospital.